Finding health care that aligns with Catholic values feels impossible sometimes, and we often get dismissed. Meanwhile, mainstream medicine keeps pushing solutions that go against everything we believe. How can you possibly find reliable fertility solutions without compromising your faith, especially when you feel like you're on your own? I'm Cristy Murray, a Catholic nurse practitioner and Creighton and NaPro medical consultant. I'm here to help Catholic women find fertility and health solutions that align with our faith. Today, I'm sharing 10 essential facts about Creighton Model fertility care that you need to know before you start. Let's get started. First, the Creighton Model isn't just some alternative method someone made up. It's evidence-based and scientifically validated. We're talking about over 40 years of research and peer-reviewed studies. This means when you choose Creighton, you're choosing a method that's been rigorously tested and proven effective. You don't have to choose between faith and science. Creighton gives you both. Second, Creighton Model requires intensive training and certification. You can't just read a book or watch a YouTube video and call yourself trained. Practitioners go through months of rigorous education, and as women learning the method, you'll work one-on-one with a certified instructor for several cycles. This isn't a quick weekend course. It's a comprehensive system that ensures you really understand your body's signals. The investment in proper training is what makes this method so reliable. Third, the Creighton Model is so much more than just fertility awareness. It's a complete health assessment system. Your cycle patterns reveal information about your hormone levels, ovarian function, and potential underlying health issues. And this is why NaPro Technology works so well with Creighton. Because we're not just tracking your fertility or your cycles, we're getting a window into your overall reproductive health. Many women discover thyroid issues, hormone imbalances, or other conditions they never knew they had, just from learning to read their body's signal properly. Fourth, let's talk about the reality of cost and time commitment. Creighton instruction typically runs between $300 to $600 for the full program, depending on your area and instructor. However, you're looking at 6 to 8 follow-up sessions over about a year, so you're not just on your own. Yes, it's an investment, but compare that to years of ineffective treatments or methods that don't align with your values. If you're feeling overwhelmed by all this information, don't worry. That's normal, and it's why I walk women through this step by step. The time you invest learning this method properly pays dividends for the rest of your reproductive life. So fifth, here's something many women don't realize. The Creighton Model actually works beautifully with irregular cycles and challenging situations. Whether you're dealing with PCOS or now PMOS, coming off hormonal birth control, breastfeeding, or approaching perimenopause, Creighton can help you understand what's happening. Even while pregnant, continued monitoring of mucus helps alert us to any impending infection that needs to be treated or pre-treated, thereby reducing any more complications while you're pregnant. And here's the really powerful part. Any abnormalities can be addressed or managed using NaPro technology, unlike other methods that fall apart when your cycles aren't textbook perfect. Creighton teaches you to read your body's unique patterns, even when they're all over the place. And this is especially important for Catholic women who've been told that their only options are hormonal interventions that go against their beliefs. So sixth, let's talk effectiveness rates, because this matters. When used correctly, Creighton Model has a 99.5% effectiveness rate for avoiding pregnancy and a 76% effectiveness rate for achieving pregnancy within the first year of use. These aren't just random numbers. They come from decades of data collection and research. But here's the key phrase: when used correctly. This is why proper instruction and follow-up are so crucial. You're not just learning a method, you're learning a skill that requires practice and guidance to master. So, seventh, the Creighton Model is distinctly different from other natural family planning methods you might have heard about. Unlike the symptothermal methods that tracks multiple signs or calendar-based methods that rely on predictions, Creighton focuses exclusively on cervical mucus observations. This single-sign approach makes it more precise and less confusing. You're not juggling temperature taking, cervix checking, and mucus observations all at once. Instead, you become an expert at reading one highly reliable sign that your body produces naturally every cycle. So 8, Creighton Model requires daily observations and consistent record keeping. So this isn't a method where you can be casual about tracking. You'll need to observe the chart. You'll need to observe and chart your mucus patterns every single day, even during menstruation, even when you think nothing's happening. Some women worry this feels overwhelming at first, but most find it becomes as natural as brushing their teeth. The daily discipline is what makes the method so accurate. Your body is giving you information every day, and you need to be paying attention to receive it. So number 9, one of the most powerful aspects of Creighton Model is how it can reveal underlying health conditions that might otherwise go undiagnosed. Abnormal bleeding patterns, unusual mucus characteristics, or cycle irregularities. They often point to conditions like endometriosis, ovarian cysts, hormonal imbalances, or reproductive system infections. Many of my clients have discovered thyroid issues, PMOS, or luteal phase defects simply through their Creighton charting. And this early detection means you can address problems before they become more serious, and you're doing it through a method that respects your body's natural design. So I'm really excited and passionate about this. Finally, fact number 10. The Creighton Model perfectly aligns with Catholic teaching values. This is the most important one. This method respects the natural design of your fertility without artificial interference. You're working with your body's God-given signals and not against them. So there's no moral compromise here. You can use this method whether you're trying to achieve or avoid pregnancy, and it honors the unitive and procreative aspects of marriage that our church teaches. For Catholic women who felt torn between effective healthcare and their ethical beliefs, Creighton offers a path that honors both. If you're ready to learn more about the Creighton method and how NaPro Technology can help you, I offer short online group sessions where we can dive deeper into your specific situation. You don't have to figure this out alone. I'm here to help you understand how these Catholic-aligned solutions can work for you. So check the link in the description to book your intro session.